Chapter 23, which begins on page 297, is the section of the book that relates to professional readiness of a counselor. You should know the terms identified on page 297 and think about some of the reasons that a person becomes a counselor, as discussed on pages 297 through 300. You should know and will be tested on the traits of an effective, naturally therapeutic counselor, as identified in Jacqueline Small's book, Becoming Naturally Therapeutic. Those traits are identified in bold type and include empathy, genuineness, respect, and self-disclosure. Within individual counseling, understand the preparation and gathering information about your client, as well as the intake process and what should be covered in the opening session. Understand the three-pronged counseling process, which is discussed on pages 307 through 310, and understand what is covered in each prong or segment of the process. Also, be able to identify the different patterns of negative thinking listed on page 310 and to be able to distinguish between them. Understand the structure of a group counseling relationship, including time limits, beginning and ending sessions, counselor versus client agendas, role limits, and process limits. Also, understand helpful statements in a group process setting, as well as unhelpful statements of expectation that will not be beneficial in a group setting. Within the family and couples counseling chapter, which begins on page 317, understand how this counseling is similar to and different from individual counseling and group counseling. There are differences between adult and adolescent chemical dependency, and you should understand those differences as outlined in Chapter 27, which begins on page 321. As the chemical dependency progresses, you should be able to identify what types of behaviors tend to occur or may be exhibited by the adolescent. Also, as the drug use may become extreme or compulsive, there may be other signs exhibited by the adolescent, such as weight loss or thoughts or attempts at suicide. Adolescent chemical abusers may exhibit delayed development of emotional and cognitive functioning, and the counselor should be aware of this when the treatment program is implemented. The counselor should know about the benefits of negotiated contracts with the adolescent in the treatment phase. Finally, relapse prevention should include referrals to 12-step programs and continued follow-up, and an aftercare plan should be developed with input from the adolescent and others. You should know who these others are. As counselors, we strive for progress, not perfection. Chapter 28, which starts at 327, discusses personal growth for counselors and includes a discussion that failure in therapy is going to occur. We can accomplish a number of things from failure, and some of the things that we can learn from failure are identified on page 328. You should know those. You should also know the 3 goals for personal growth examination, which are identified at the bottom of page 328 and the top of page 329. In order to grow personally, know that the manual suggests that we examine things ourselves rather than simply rely on others to provide us with accurate information.